Here's what she wants to know. I was in a car accident and my wrist was really sore. I went to an orthopedist who said the pain and soreness was caused by arthritis, probably from an old sports injury. The weird part is I didn't have any pain or discomfort before the accident. Is that common? So, Doc, arthritis affects so many people, and this is a very interesting question from Caroline. So, what do you have to say?
Well, number one, can you get arthritis from an old sports injury? Yes. And that
Mhm.
arthritis you didn't actually really recognize. And so I have many senior amateur athletes come in and their golfing buddies or their tennis buddies say, you need to go check out that lump on your wrist. It might be cancer because, they're getting to that stage where it's important to them and they'll see a swelling here. And I can pick you out in the grocery store if you have that, because then I know that you have an old scapholunate dissociation or an old scaphoid fracture. And many times they'll come in and they're coming in for the lump, not for pain. You get the x-ray and there's terrible arthritis there, but they're still moving, they're still doing everything they want to do. And I say, are you still betting while you play golf? And they go, yes. Well, then don't stop. Don't stop and do something just because I found something on x-ray. Now, I would submit that probably if that orthopedic surgeon is telling her she has an old sports injury, it is something on that order, either a scapholunate dissociation or an old scaphoid fracture, or that just shows an old pattern of arthritis typical of an old sports injury. Do you have to do anything about it at that point? No, but you do want to splint things. And one of the things that we found looking at some testing that we did in the lab was that an awful lot of people have multiple fractures in their wrist after they've had a fall that get totally missed because it's not picked up on the x-ray. And the way to see it is with an MRI. Well, you're not going to MRI everybody that falls on their wrist, and complains of pain. So immobilize it, see if you can get it better. And if it doesn't, then it's time to begin to talk about what are the other kinds of procedures that you can do for wrist arthritis, and they're numerous. So there's a lot of, it's again up to your physician what they feel comfortable with. It's up to you what you feel comfortable with. But as long as you can avoid and evade surgery at this point, better. So I tell people to get a lion's paw splint, which is the leather brace that the gymnasts use for the Olympics. And that's what allows them to do the uneven parallel bars. This will allow you to go back and do things, but protect it. And the other thing is if you have some old wrist ligament injuries, uh, don't do flat on the floor, push-ups, downward dog, do it on your forearms. And so those are some of the interesting things. Don't do a clean, a deadlift, and don't do flies because that also gets your wrists into a position where they're having to try to stabilize, and now you're causing more damage in the sense that you're hurting more. So let your ligaments have a chance to heal up. So don't go into those extreme extended and flexed positions. And most sports you can play in a neutral kind of position and use the lion's paw to allow you for motion, that kind of thing.